Hi guys, I'm Dr. Parissis and welcome to another video. Now I got an interesting question from one of my viewers who asked, would adding Dutasteride once a week to Finasteride 6 times a week make any difference versus daily Finasteride only? Now my response to this question usually relies on this 2013 paper here. Now some of you may have seen this paper from other hair loss channels, but in summary, a 47-year-old man was treated with Finasteride for male pattern baldness to begin with. And despite continuous treatment on Finasteride, his hair density in the crown started to reduce after 4 years on Finasteride. So his doctor added in one dose of 0.5 milligrams of Dutasteride per week to his protocol. And this resulted in a significant increase in hair density in the crown. So this is what he was working with at the start. This is his starting crown. And this stayed the same for just under 4 years. This is then after the 4-year mark when the density of the crown started to decrease. Then this is after just 3 months of adding in one dose of Dutasteride per week. Why might this actually work? Why might this doctor actually be onto something? Well, as we know, Finasteride and Dutasteride block the conversion of testosterone to DHT, which is the main hormone responsible for hair loss. And another thing that I want you to know is that there are 3 types of this enzyme which converts the T to DHT. Type 1 5-alpha reductase enzyme, type 2 5-alpha reductase enzyme, and type 3. Type 1 and type 2 are generally accepted to be most involved in hair loss, although we don't know as much about type 3 and it could be as well. Finasteride only selectively blocks type 2 enzyme. And so if we only use Finasteride, we're not getting much type 1 blockage. And since we know that the type 1 enzyme is in the sebaceous glands of hair follicles, we might be missing out on preventing hair loss from blocking type 1. Bringing in that once weekly Dutasteride, we can block both. Since Dutasteride blocks type 1 enzyme 100 times more potently than Finasteride does. And the fact that this patient had so much regrowth in just 3 months of adding in a once weekly Dutasteride reconfirms that type 1 blockage does have an impact on slowing down hair loss or even regrowing hair. But how can we get away with just taking one dose of Dutasteride per week? Surely that's too little, you might say. Well, Dutasteride actually has a very long half-life, specifically 5 weeks long, meaning that it stays in the body for a very long period of time. And because taking 0.5 milligrams per week is similar to just under 0.1 milligram per day, you can see from this graph here that 0.1 milligram per day still inhibits a lot of the type 1 enzyme, but not as much as if we were to take 0.5 milligrams daily, something that could save you from getting side effects. Now, if you're wondering whether once weekly Dutasteride is for you, if you're worried about what hair loss stage you may be at, if you want to know what kind of medication changes might be suitable for you, whether you would be a candidate for hair transplant surgery, or if you wanted an in-person trichoscopy exam where we can look at your hair follicles under a high-powered microscope and see what kind of loss and kind of predict what kind of loss you are likely to experience in the future, reach out to me at drparissis@gmail.com. Send me a few images of your area of concern and we can come up with a concrete plan together. Thank you guys for watching.